everyone. Welcome to Talk of the Town. I'm Robyn Zimmerman. With us is Dieesha Hicks, and she is a state health insurance program specialist with LowCountry Council of Governments. You're back with us.
Thank you for having me.
We had a good discussion last time, so it's good to see you again. And this time we're going to talk about a pretty heavy subject. It's called Medicare fraud. So let's start with SMP. Well, first of all, is fraud serious? I mean, is it prolific?
So Medicare loses about $60 billion a year. It is a real problem.
Oh my goodness.
It is a real problem. So the most important thing people can do is protect themselves, because this is your health care. If we don't stop the fraud, that's why the premiums keep increasing every year in order to pay for Medicare.
Right. So SMP is like a patrol, right?
So it's the Senior Medicare Patrol. It's another one of my programs. So kind of focus on the fraud aspects of Medicare, trying to navigate people through it, trying to prevent it, things like that, teaching people how to protect themselves.
So let's talk about some of the most common scams, Dieesha.
So the first one is that we all get those calls every day from different numbers. The main thing I want people to remember is that Medicare, Medicaid, nor Social Security will call them first. So you have to make an appointment with Medicare, Medicaid, or Social Security for them to even call you, or they will send something in the mail.
Okay, they're not going to just call you out of the blue.
Right.
Okay, so you'll get something in the mail from them, or you go and make an appointment. You have an appointment, and then they might call you back after that.
Right.
Is that what?
That's what it is, because most of the time, that's just people trying to sell them something.
Okay.
And so once your Medicare number is out there, it's kind of like your Social Security number.
Right.
You have people that sell them off to different companies, and they get kickback schemes, and you get billed for things that you didn't even have. So
where is most of the fraud happening?
It's an abundance of it, like you wouldn't even imagine. So it's those that are getting access to people's Medicare numbers. They're selling it off. People are getting billed for things like COVID tests, or the new one is catheters that they never received services for.
Oh my gosh.
They get things in the mail that they didn't order, like back braces, hand braces, leg braces. The best thing to do is to send that back. You can contact your Senior Medicare Patrol for this area. It would be me. And we could try to resolve the issue, because once your number is compromised,
oh wow,
they just keep selling it and selling it and selling it. And if Medicare sees something that looks like you're ordering too much items, it could jeopardize your Medicare number.
Right, so we don't want to do that.
Right.
I love Medicare. You know, I went on at 65. Of course, a lot of people don't realize it comes out of your Social Security automatically. But it's a great program. So we want to protect it. And so what are some other ways can we seniors protect ourselves from fraud?
So one main thing is to check your Medicare summary notice.
Oh, I never really do, Dieesha.
Because sometimes you may have a claim that for a service that you never received. And it's not just the fraud cases sometimes it's errors on the physician billing or hospital billing. Okay. And you could be left with a bill, and it could have just been human error. So it's good to kind of take note. If you go to the doctor May 2nd, I saw this doctor this time, I had this procedure done.
Yes.
Kind of make note of that, and you can see that lined up on your Medicare summary notice.
Would you say most people don't really look at that notice?
They don't, until they get a bill in the mail.
I see. Okay, but even if you have supplemental, hopefully you don't have to pay anything, but a lot of people probably don't have supplemental.
And a lot of them have Medicare Advantage plans, and if you have a Medicare Advantage plan, check your explanation of benefits, which also comes out to them like the Medicare summary notice.
I just have to say this, Dieesha, you're so smart, and you know, you're so you can help people understand. It's such a complicated topic. And so we need people like you to help guide us through. Particularly, we don't want to be compromised, our Medicare number be compromised. So how do we get in touch with you?
You can reach me directly at 843-473-3996. and I'm here to help with all things Medicare. And another good thing to remember is that we're not getting new Medicare cards. So if you get a call, someone saying that you're going to get a Medicare card with a chip in it or a plastic one, no, you're going to keep that same paper copy.
Okay, and if you need to email Dieesha, it's DHicks at LowCountryCog.org. Okay, thank you so much, Dieesha.
You're
we'll
welcome.
See you hopefully again next month with
yes,
more,
ma'am, I will
more
be
tips.
Here.
Appreciate it.
Thank you.